Now, if you're sent home with drains after surgery, these are going to be the instructions on how to take care of it. First of all, the supplies that will be sent home with you is an instruction sheet on how to do it, as well as an area that you're going to document how much drainage comes out of the drains. You will also be sent home with a cup as well as a lanyard. If you have gloves at home, you can go ahead and use gloves. If you do not need to wear them, but do just make sure that you are washing your hands afterwards. This portion of the drain will be in the incision inside the body. What you're going to want to do prior to emptying the drain is you're going to want to do what's called stripping of the drain. Sometimes you will notice in the tubing there will be darker areas which are known as clots. These clots are okay, but we do want to make sure that we get that clot down the tubing and into the drain. What you're going to go ahead and do is you're going to take 2 fingers and pinch while you take your other 2 fingers and strip the drain. You're going to hold it tightly, release these 2 fingers, and continue to do that until you get the drainage or the thicker clot into the bulb. So these drains will be hooked to the garment that you're wearing by this blue little clip here. There will come a time when you are able to shower after surgery. Since you will not have your garment on, we have supplied you with this lanyard. When you do shower, you're going to want to place this lanyard around the neck area, and then what you're going to do is you are going to clip the drain onto the lanyard. So this is what you will wear when you're in the shower. So to empty the drain, what you're going to want to do is you're going to want to find the little flap. You're going to want to make sure that you do keep this away from your face area in case there are any splashes. You want to gently remove or pull out the flap. The bulb will then pop open. You want to measure the drain in an open position. You will notice on the bulb, it does say 25, 50, 75, and 100. This is a guesstimate, so I would say that there's maybe about 20 cc's in there. You do want to then take the cup that has been provided for you. You want to empty the drainage into the cup. Then these drains work on suction, so you do want to make sure that you squeeze the drain back together to engage that suction and then place the flap back into the holder. Once again, you do want to make sure that it is squeezed together like that because that is engaging the suction. You will then go ahead and take the drainage and pour this down the toilet. What you then need to do is you need to go ahead and make sure that you are documenting the amount of drainage that you are getting out of those drains. Date, time, and the amount. Some patients will have more than 1 drain, so please make sure you mark it accordingly. Now, you may be sent home with a drain that has a different port. With this one, what you're going to go ahead and do is you're going to unscrew the top, gently let the bulb open. That is when you're going to look at the bulb and once again look at the numbers. There's about 20 cc's and then pour it into the cup. Once again, you do need to squeeze the bulb tightly back together to engage the suction and then screw the top back on.